Hi, this is Bobby at SRS Web Solutions, home of mConsent and CareTap, and I have Dr. Sarah Cody with me today from Lift Dental in Stillwater, Minnesota. And I asked the doctor to join me for a discussion today on how their dental practice is operating during the COVID-19 situation. Good morning, Dr. Cody. Thanks again for joining us today.
Yes, good morning. Thanks for having me. Like Bobby already said, my name is Dr. Sarah Cody. I'm a general dentist in Stillwater, Minnesota. We opened up our clinic in 2019 and considered a modified startup. So, during this COVID time isn't kind of something what I was expecting to happen during this first, 2 years of the practice. So just like so many are feeling of that, concerning time and stressful time. But this will be a good topic today on, what we can do with teledentistry that's being offered right now and, how we can get through this troubled time.
So currently with the ADA, you're mainly only able to see emergency patients in office. Does your office do any emergency visits right now, or are you mainly just doing the teledentistry?
Yeah, so right now what we're doing, I've been mostly triaging patients by phone, but pretty excited to be working with you. And Bobby's humble enough that he's like, well, you don't have to give us a shout out or anything, but I'm excited to work with mConsent and, have this new platform, the teledentistry, where I'll be able to do video consults now with my patient. Because like I said, I was just doing, triage through the phone, which it works, but to have that personal, connection and talk directly to your patient is priceless. But along also to be able to, maybe they can show you, if they go real close up, this is what I'm experiencing, or you can just take a look at their face, their eyes, do we have swelling? How are they looking overall? So I think it just adds just another level to, help triage our patients during this time.
So going on the teledentistry, what services are you able to provide with the teledentistry, and how easy is it for an office to get started doing that? From some of the previous discussions I've had with doctors, some were just unaware of that this was an option, and some said that, we like to provide more of face-to-face interactions. It's hard to do video consultations. So how has that experience been going for you so far?
Yeah, ADA has put out a great summary and a lot of detail into, what qualifies, what kind of charges you can do, what codes to use. So anyone that's just new or getting up and running with this, I would take a look at the resources the ADA has posted. But they are allowing you to do the, D140, the limited oral eval, and the D170 reeval, and there's a D171 reeval. That's a post-op visit. Along with those codes, they want you to use a teledentistry specific code, and it's a 9995 or a 9996. And again, to get more information on the details, I would look up through the ADA for this. But these codes will help, for your office to continue with the triage care, and then also to be able to submit that to insurance to get some reimbursement for your time and efforts.
With the teledentistry, with ADA, it's a federal option, so no one has to be stuck in their state law if they're not able to do it. Is that right?
Yeah. Yep. And it's right now, what's nice if you use a platform like I'm using I'll be using the mConsent. It's going to be the HIPAA protection, but right now they're being, it's forgivable right now just because of this uncharted time. And they're allowing you to do, FaceTime and Zoom and Skype. But if you're going to, be more serious about even using this in the future, you might want to, set yourself up to have something more HIPAA protected. So
talking a little bit about your business, what are you and the staff doing to stay busy and motivated with more downtime now?
I honestly have been busier than ever. I think there's two ways to look at this. Obviously, I go through those emotions too of, being scared and the uncertainty of the time, but I'm trying to stay, more on the positive end and seeing this as a gift of time. And what can you do to make yourself better? What can you do to make your team better? What can you do to make your office more efficient? So I think it's viewing it in a different way. And we're all in the same situation, everyone, and it's a scary time, but let's not focus and dwell on that. Let's take a look at the larger picture and what can we do to be better. So during this time, we're more than ever the personal connection, whether it's you and your staff, family, your patients. I think that's one thing we shall get the emphasis on is, calling on our patients, calling on our team, calling on our families just to check in and make sure everyone's doing all right. There's tons of CE opportunity out there right now, and that'll fill your day as it's filling my day.
Sure.
Reading books together, motivational books, working on systems. This is a great time right now to see, how can your office become more efficient? And, something like with Bobby and mConsent has made a big difference for our practice to be more efficient on the front end with all the paperwork. So it's something to take a look at, what systems are you going to bring on? So you don't, maybe not have to pay someone the overhead of all the patient intake forms and the shredding and everything that goes with that.
So has your office started planning for return of patients? Like what preventive measures, if you've put any in place yet, would you have? And what would you tell the patients who, of course, will probably be worried to start coming back out into the offices, and especially those at risk? What would you say to those patients?
Yeah, and it's, not even only just the patients and their fear and scare level, but it's also us, the team members. And so, it's a two-way street. So currently what we're doing is when I'm screening, triaging patients on the phone is just doing a COVID screening, just so we get an idea, have they traveled? Have they been quarantined? What are their symptoms? Where do they live? Are they working? Just so you get a risk idea. And we'll be continuing with that. And what I'm excited about through mConsent again is they just came up with their COVID questionnaire. What we're also doing currently is having patients just wait out in the car before they come into the office. We're doing a 1% hydrogen peroxide rinse. When they do come in, obviously all PPEs are on. We're right now having full face shields fabricated for all the team members for when we return. And we'll be listening to the guidelines of what they're also going to be having us do. Wouldn't be surprised if it's going to be hopefully COVID screenings, maybe air filtration. We're looking into extra oral suction devices. So there'll be a lot of changes with what's going on. And so it's being able to adapt and look into what is it going to take to keep, patients safe and our team safe and just make us feel more comfortable going forward.
Yeah, that's most of what I had, Doctor. So thanks again for joining us and educating us on how to safely operate during the COVID-19 situation, and also providing information on how the dental practices and medical practices can stay operating during the situation, telemedicine and things like that. Do you have any other final thoughts for the viewers?
I think like I was hitting on before is see this as an opportunity to get better and be better and make your practice better. And focus in on the positive. There's a lot of cool, awesome things that are going on. So thanks for having me, Bobby.
Great. Thanks again, Dr. Cody. And have a good rest of your day.